Hi everyone, my name is Divya. I am an IC intern with the SISGI group. Today, as part of our Beyond Good Ideas series, we're interviewing Dr. Schiavo, who is the founder and president of Health Equity Initiative. In short, Health Equity Initiative is a nonprofit that is dedicated to helping eliminate health disparities and achieving health equity. But she'll be able to tell you more about that. So first, I would like to thank Dr. Schiavo for joining us today. How are you?
Hi, how are you, Divya? And thank you very much for inviting me for this Google Plus Hangout. I look forward to sharing our work and experience.
So I guess we'll start off first by asking, what is it that your organization, Health Equity, does?
Our mission is to build community capacity and strategic communication resources for health equity. In a nutshell, we know that health disparities continue to be a major issue both in the United States and abroad, and actually there is very little awareness of disparities if we consider that in one decade awareness of health disparities has only increased from 54 to 59%. So one of our areas of action is to build awareness and build community around health disparities, because we think that only a committed community can actually help solve health disparities. The other area of action is capacity building. We basically train different professionals from multiple sectors on strategies and trends and disciplines that may help them to address health disparities, to improve their services for disadvantaged groups and others. And then the other areas is actually research toward the disparities. So we have several programs that we can discuss in more details as we move along with the interview.
Okay. So what brought you to this this field of work? What made you passionate about health disparities and deciding to create this nonprofit?
Well, I think that most of my work throughout my career has been dealing with vulnerable and underserved population, with those population who actually, whose voice is very rarely heard. And I felt that there was a need for a stronger focus on health disparities, and also to bring in my experience. I had the good fortune of working in so many different sectors, from the private sectors to academia to nonprofit organizations, and I thought that the disparity conversation should go behind basically the people who are most affected, and also behind the people who try to solve these issues because they work in some sort of healthcare related or health or public health capacity. So I thought that because of my work with so many different sectors and my ability to speak the language of all of these different sectors, I could bring that experience to create collaborations and to create a community that will be really committed to health disparities. Health Equity Initiative, as you know, because we had the good fortune of having you as a summer intern, Divya, is currently considering evolving in a multi-sectoral association, and this is part of our continuous efforts of building community around the health equity issues, making sure that if a baby dies in a given community of infant mortality, it's not only the problem of the community that are most affected, but altogether creatively we try to find solutions. And the idea of a multi-sectoral association is in continuation of our efforts to engage communities, but it's also an idea that has been asked by our followers who really feel they need a multi-sectoral professional home on health disparity and health equity only.
Right. So then part of that, I guess, would be agreeing when you have a multi-sectoral organization or trying to get people to collaborate. I guess there must be some kind of definition of health equity that you are trying to get out. So what would you say is your definition of health equity? What are you trying to achieve in that way?
Well, health equity is a complex concept for most people, and that's why we have so many issues raising awareness of it. Equity is related with this fundamental principle that we all need the same opportunities. We all need the same chances to succeed in society and to stay healthy. And the way we define it is providing everyone with the same opportunity to stay healthy or effectively cope with disease. And this has to do with that are focused on social factors that determine health and illness. And that's also a very difficult concept to grasp, because I think that most people don't think of health in terms of social factors. They think of health in terms of health and illness. And although there are studies saying that in different communities or in different ethnic groups, we think about health as overall well-being, in reality, most people don't think about the social factors that influence that. They don't think that not having a park in their own community prevents their ability of exercising and staying healthier. Don't think about the fact that we are asked very often to eat nutritious food, but if we live close by a food desert, I think that it's more difficult to implement those behaviors. So one of our approaches is to building community around these issues and making sure that we collaborate more and find solutions that are multisectoral. And I think the multisectoral association will do some of this work in trying to find solutions and bring different sectors together and try to address these different issues, whatever they are.
Okay, so I guess you're saying that the key to achieving health equity then is more collaboration and more multi-sector work, correct?
Yes, and also raising the influence of community voices on health equity. As you know, we have a program that is called Health Equity Exchange, in which we have been attempting to create a sort of a virtual town hall where people could tell us what health equity means to them, and if they had it their way, what their priorities will be. And we see that this is really community or individual specific, because some of the people will tell us, for me, health equity is related to cultural competence in the clinical settings. I want the physician, the nurse, the healthcare provider to talk to me in a way that I will understand it and that will be relevant to my culture. Other people will tell us, for me, health equity is related to living in a neighborhood that has less crime, because if I had to exercise at 9 o'clock at night, I currently cannot, because I don't have the possibility of going out. So we think that raising those voices and making people more part of this dialogue and inviting them to establish their own objectives is key to resolving disparities.
And so then what might be your strategic vision, whether it's for your organization or maybe society as a whole? Here at the SISGI group, we focus a lot on social change and sustainable efforts to create social change. So what might you would like to see happen in, say, maybe 5 years, or your future goals?
I think from an organization perspective, we're currently going through a series of public meetings to evolve into a multisectoral association, and we would like to continue to raise awareness of health equity and health disparities, and to continue to build community around it, and also to continue to build capacity. We think that awareness and capacity building of different sectors in addressing disparities and communities themselves are key to accomplishing innovative models to resolve them. We, from a society perspective, I would like, again, more collaboration and more continuity in some of our efforts. I think that a lot of times we see that the focus for a few years is on health equity, and then a few years after is on universal healthcare coverage, and a few years after is on community development. I think more continuity and integration of all of these areas are fundamental, because by doing it in a sequence, and we miss a lot of the synergies between all of these different areas. So it's quite important from a society perspective to always maximize this opportunity for collaboration and investments in different sectors.
Okay, great. So is there anything else that you'd like to share about your organization in terms of some interesting projects? I know you discussed the professional association. Is there anything else that you guys are currently working on?
Yeah, we have been working, as you know, Divya, also on a Sports for Health Equity campaign, which is a campaign to raise awareness of health equity and its root causes. And we have reached through our mass media and new media outreach already more than 1.3 million people, thanks to the generous involvement of our celebrity spokesperson, Essence Carson, who is a WNBA player with the New York Liberty here in New York City. We we are moving ahead also with an effort of creating materials for schools, high school and middle school, on health equity and health disparities, because we think that a lot of these conversations need to start early on. So it's important to continue to prepare the next generation of leaders to tackle disparities in a way that a lot of generations have been struggling with. So this is another project that is very important to us, and also stay tuned for our upcoming report on the health equity exchange, which is this virtual town hall I was describing before, to create a proof of concept of the importance of community voices on health equity, which the report will be released sometimes this fall.
Okay. As you said, it is really important for getting this message out to people who are younger so they can start working on it. So that said, do you have any advice? As you know, I am a student interested in public health, and if there are any other watching, what kind of advice might you have in terms of their career if they are passionate about health disparities, and what steps they might take to achieving that?
Yeah, I'm very, very excited about the fact that you are interested in public health, Divya, also because I have had an opportunity to interact through my academic positions that are outside of health equity initiative with a lot of public health students I've been teaching, but I just wanted to say that the most important aspects is to go and pursue your ambitions, pursue your dreams. There's nothing that is easy that comes in public health. Everything requires a lot of effort, and it's very easy to get discouraged because you will always have a lot of people who will go back to what they know best. It's a normal thing to be afraid of change and to say that your idea has not worked in the past or may not work or so on. But I think that real innovation has been always, the result of very transformative moments, and that's very important to take into account and making sure that you actually pursue your dream and insist and you're perseverant.
Okay. I can tell you from personal experience, I am also an intern with Health Equity Initiative, so I have had a great experience working with them. So those of you who are interested, I would highly suggest becoming more involved with their organization. And with that, any final words, Dr. Schiavo?
No, I think that it's been great to have you, and we definitely want to have more young people be involved with our organization as interns or others. So please visit our website at www.healthequityinitiative.org to learn more about our work, and consider participating in our upcoming meetings as well as in our professional development workshops. And thank you very much for the opportunity to have this chat with you today, Divya, and best of luck with the new academic year.
Thank you very much. And once again, on behalf of the SISGI group, I would like to thank you and all of those of you who have joined us to watch today. Thank you very much.